A lot of talk about vaping and the dangerous health conditions that it can lead to. And these are new conditions that we're really just learning about. The Dallas County Commissioners Court brought up the issue today, and the CDC recently announced it is activating its Emergency Operations Center. So joining me right now, we have so many questions here. Dr. Gary Schwartz, a lung surgeon at Baylor University Medical Center. I'm just going to start with, what exactly does it mean that the CDC is opening this Emergency Operations Center? How does that change things?
Well, it doesn't change anything day to day in terms of how we take care of our patients. We're just recognizing this is a national epidemic and organizing centrally through the CDC to start researching it and gaining more data from the rest of the country.
And I think I saw we have 4 new cases here in Dallas County. What do doctors know about this lung disease at this point?
So sadly, we really don't know a whole lot. Symptoms that we previously attributed to other conditions, we're now finding there's more of a pattern in patients that vape, and we're seeing a very wide spectrum of how these patients are presenting, how sick they are, and how we're going to take care of them.
Does it matter what specifically they're vaping, or is that still part of the investigation?
It's definitely still part of the investigation. Some regions in the country are seeing more patterns in terms of different products, more THC-based versus e-cigarette, but clearly we're way too early in the game to really know the difference.
As a lung surgeon, how concerned do you think that people need to be at this point? I mean, so many people vape, not just adults, but, you know, unfortunately we see a lot of teenagers too, and we've seen some instances where some younger people have presented with some of these symptoms. How concerning is this?
It's very concerning. We're actually seeing worse symptoms in the younger population than older, and because we really don't know the natural history of this problem, it's very serious. And the general recommendation now is to not vape at all any product.
So when somebody comes in with possibly a lung disease at this point, what happens?
So we work them up, evaluate them like any other lung problem, make sure there's no infection going on, do all the normal battery of tests, and it's really a diagnosis of exclusion at this point. We want to make sure there's nothing else that's treatable before we blame it on the vaping, and then it's really just supportive care in terms of getting them through the acute illness.
What are the concerns as far as symptoms go that people need to be on the lookout for, and at what point should they seek medical attention?
Anything out of the ordinary, really. Difficulty breathing, difficulty catching your breath, fever, coughing up a lot of mucus, and definitely blood.
Yeah, really scary stuff. Dr. Gary Schwartz, Baylor University Medical Center, thank you so much. Some really great information there.